So a concussion is a traumatic brain injury that is oftentimes a result of a blow to the head, but it can sometimes be a blow to any part of the body with forces being transmitted to the head. Whenever a person has that traumatic force transmitted to the head with a traumatic brain injury, this oftentimes results in a functional disturbance. And what that really means is that the person's brain is not functioning how it normally should. And oftentimes that manifests itself in various signs and symptoms of concussion, ranging anything from headache, nausea, dizziness, not feeling right, and many other symptoms. The majority of concussions do not include loss of consciousness. Over 90% of all concussions do not have loss of consciousness as a key component, so I think that people need to realize that oftentimes it's just a series of symptoms that can make up the diagnosis of a concussion. When a person has a concussion, you really want to cater to their specific symptoms that they have. But some general tenets or thoughts about treatment are that you don't want to do any activity that worsens their symptoms, and you want to try to avoid further injury or blows to the head while the patient is currently recovering, as that can oftentimes result in worsening symptoms. But really the treatment should be tailored to the individual. There is some data to show that if you suffered one concussion that you actually may be at increased risk of a subsequent concussion. We don't exactly know all the reasons as to why that is, but I think that again, the focus should be trying to be aware of the signs and symptoms in case you'd have one, that you can seek medical attention. Obviously, the higher level athletes have more force and more power and more speed to generate those big collisions, but even young children can still generate significant force enough to cause a concussion. And there's actually even some data to suggest that children might be even more vulnerable to a concussion than their adult counterparts, and we don't again understand fully as to why that is, but again, any age can really have a concussion. I had the opportunity to see the movie recently, and I found it to be very enjoyable, but the thing that I enjoyed most about it was the fact that it increases the awareness about concussions. I think that really we still have a lot of research to do, and we may need to have a sequel to this movie when we know more information about what's going on, but I do think the key is increasing the awareness about concussions and making sure people really understand that concussions are an important topic, and we need to continue to move forward with research in this area. So I do have two boys and another boy on the way, and so this question will likely come up. And to put it shortly, I probably would say I might allow my children to play football, but you also have to realize that I myself was both a high school and a collegiate football player, and I think that the benefits of sports were immense, and I don't know if I'd be where I am today without many of the benefits of sports. However, I do think that each person needs to weigh the risks and the benefits individually for that individual or for that family and make an educated decision. But I do think the game is a lot safer now than even when I played 15 to 20 years ago. A lot more rules have been made to help protect players and athletes, and I really think we're headed the right direction. You know, I don't know what the NFL knows and does not know, but what I do know is that many groups and organizations are making strides to help protect athletes. And it's not just the professionals that need the protection and awareness, it's the younger children as well. And so I think that we really need to continue to move forward and focus on the future rather than dwell on what was known or not known in the past.